I can't, I've got to send my cat to school. We've got so many different reasons why we don't donate. How many registered Democrats are there in the state of Utah?
Well, we do have many that works in Weaver County.
Yeah, and I told you this.
Yeah.
118,000, and there's 10,000 Democrats in Weaver. So if they donated $25, how much money would I have for my campaign? Just from Weaver County, 250,000, $250,000. That's more money than we've raised in a lot of Senate campaigns. If every registered Democrat gave $25 in the state of Utah, I would have $2.9 million to be able to run this campaign. Money is extremely important. If we don't start waking up and realize that we've got to get it, we've got to donate it, we're not going to win. We can't win without the money. So what we need to do is we need to find common ground with our Republican neighbors. And I think it's extremely important that we don't, it's this idea that, well, Democrats are baby killers and, they want to spend money like it's going out of style. Well, you have now in me a candidate that basically says he understands the debt, he understands the deficits, he also understands how to get the country moving again. It's my accounting background, it's my financial background, I know how to do it. So the one thing that you have common ground with the Republican neighbors that you have is that they're going to talk about, well, you know what, we've got this debt problem and the government's, spending. We'll say, look, you know what, there's this really good candidate, Christopher Stout, who has that problem solved. And it's going to take all of us working together. Won't you join him? We have to become a message machine. We have to become a money machine. We must walk the precincts to meet the people, to meet the Republicans, and let them know this is the message and this is how we're going to get someone elected that will do something. Money, money, money. No money, no Democrats in office. Let's talk about the two candidates that I think I'm going to be facing. Number one, I don't think it's going to be Bob Bennett. He's got 4 or 5 issues that he's talking about. Main Street Revitalization Act of 2010 doesn't immediately help small businesses. We've got to immediately help small businesses. We've got to give them tax breaks. We've got to get them small business loans. They need money. There's no credit. We've got to get the credit markets opened up. They need money to be able to get those jobs. The Economic Disaster Prevention Act that he came up with doesn't prevent anything. The disaster has already started. We've got to reduce the debt. He voted against the task force for responsible fiscal action of 2009 after co-sponsoring it. He co-sponsored the Healthy Americans Act, which mandated insurance. Now he opposes the same Senate mandate that's there now. He opposes that. He's not going to vote for it. He doesn't meet the needs of Utah. Though that's where I'm going to hit him hard on. He doesn't meet the needs. He's out of touch. He's a flip-flopper. And once we get that message out, the moderate Utah Republicans will find something to vote for. But let's go back to why I said Mike Lee is the one that I think is going to win the nomination. Yesterday, there was a straw poll in I believe Cache County. They did 225 delegates were up there. Bennett failed to reach 40%. Mike Lee got the majority of the votes. I think it's going to be Mike Lee. He's passionate about the states' rights issue. He's building on the far right base. I don't believe that all Republicans in the state of Utah are that far right base. I believe that there's a lot of good moderate independents, a lot of good moderate Republicans. So let's hope that Mike Lee gets the nomination, and let's hope that I get the nomination, because what will happen at that point is that you will see all these people saying, this guy's got issues. Well, why would we want to send someone who's far right, who believes that the only way that we're going to solve the debt is to raise taxes on the poor and do away with Medicare and do away with programs that help people, when there's a candidate out there, me, who is able to say, this is how we're going to resolve the debt, this is how we're going to resolve our problems. Because you know as well as I do that a far right individual is not getting things done in the Senate. It's just not happening. So we need, as Utah, a good, moderate center person that understands how to get the economy moving, how to reduce the debt, and that understands that's most important. All right, well, I've taken up a lot of time, and I certainly appreciate it. Again, my plan for the future, I have a plan, I have a vision, I'm forward thinking, and the other thing that I think works for me is I'm not a politician, and I'm a common person, and I feel the people's pain. I've been unemployed. I don't have insurance right now because I can't afford it. And I'm probably one of the worst people in that the plan, the healthcare plan is designed to prevent. Because when I have an emergency, I go to the emergency room and I just pay out of pocket. I had been paying close to $4,000 in insurance every year. Well, okay, so I paid $800 to the doctor last year in prescriptions. That's all I paid last year. This year there's a little bit different story.
And what happens if you get cancer tomorrow?
Well, that's a good point. What happens is even with health insurance, it's no guarantee that I'll get treatment, and there's no guarantee that I will.
I have insurance right now, but it has a $10,000 deductible, and the only reason I have it is because if me or my wife gets cancer, I don't want to be bankrupt. So.
I don't either.
You're in the same boat. I'm just asking
the problem is
question.
the problem is
if you or your wife.
I'm going to go bankrupt because that's what everybody in the country does. I know very few people. I know of very few people that have insurance that have paid them their lifetime cap. Because you got a lifetime cap.
It's $2 million. I know I could bust through it, but I can't.
So then what do you do?
Financially irresponsible and say, because I feel like if I was to file for bankruptcy, that would be financially irresponsible. I mean, obviously, I'm going to do what I need to do to try to avoid that situation.
Right, but I have other insurance. I don't have health insurance for that.
So you have catastrophic.
No, I don't even have that because and we can talk about this. Basically, I have income. I have income insurance, business income. If I get sick, all my business income is taken care of, and that's really what's going to keep me from because at that point I become eligible for Medicare, Medicaid, and I'll let the government take care of me.
I hope you don't tell people that on the stuff. I think that's financially irresponsible.
You're right.
I think,
but
I think the system's screwed up, and that's why
you're right.
Here today. But I'm also paying $80 a month for insurance that has a $10,000 deductible because I don't want to be that person that has to bankrupt, because those costs just don't go away. When you file for bankruptcy, we all get to eat it.
Right. So
but there's also the other side of that when somebody who has a job, and this has happened in my family, when somebody who has had a job, has insurance, has paid into the system every single day of their life, and then all of a sudden something catastrophic happens to them. He lost his job, he lost his insurance, and for 2 years he was in the hospital before he passed away. And unless his wife would quit her $12 an hour job, they couldn't qualify for Medicaid. And because he was the sole caretaker of the family who had always supplied insurance for his family, they were without anything. And they tried, and our family all gave them money every single month to try and avoid that. But 2 years in the hospital, they had over $4 million in hospital debt.
Your catastrophic insurance doesn't do anything.
So talk about health insurance. I don't want to take your time, but talk about these are real issues.
These are real issues,
and you haven't really addressed
healthcare. Well, because healthcare is the major thing that's going to suffocate the economy. It's why Obama has been pushing it. It's why the Democrats have been pushing it for years.
But this bill does not address the needs of everybody in this room.
No,
it does not, and that's the problem that I have. I hate to sound undemocratic, but his bill will not help my sister-in-law, who had to take out the one that Obama is trying to push forward. There's no public option.
Right.
She still would have had to take out bankruptcy, and she had no other choice. How do you, as an uneducated person who has always made $12 to $14 an hour, pay that off?
Can't do it.
I think as Americans, we're better than that.
Right. Even us, we're having an intellectual conversation right now. We can't even figure it out.